Throwing a football takes a lot more than just using your arm. It uses the entire body. First, bending at the patella helps give your body good balance. Next, when you step, your arm bends in a right angle on the joint between the radius/ulna and the humerus. Finally, the entire arm rotates on the clavicle and the shoulder. The shoulder rotates 360 degrees and releases the ball at about 180 degrees or the highest point.
When the shoulder moves the way it should, the thoracic spine, scapula, and glenohumeral joint all work together to create smooth upper body movement. It all depends on quality motion or movement at the adjacent or preceding joint. There are two major muscles that cover these joints. The first group of muscles are the deltoids. The deltoids are responsible for lifting the shoulder in the front of the body. Also, it is responsible to bring the flexed arm back toward the body. Finally, they are used to externally rotate in the shoulder. The second group of muscles is the rotator cuff, which are smaller muscles, equally vital in keeping the shoulder strong and healthy. They are responsible for internal rotation at the shoulder. The deltoids are the big movers, while the rotator cuff are the stabilizers in the shoulder.
The muscle system controls the movement in the body. This organ system is used to throw a football. The muscle system works with 5 other systems in the human body. Also used to help in throwing a football is the skeletal system, which is attached to bones and allow them to move independently. The muscle system works with the skeletal, nervous, respiratory, digestive, and circulatory systems because there is muscle used in order for those systems to work and be strong. However, the skeletal system only works with one other group, being the muscle system. Skeletal muscles must be attached to something at either end to give them support while they contract. The skeletal muscles are connected to bones through tendons.
If the skeletal system is not properly functioning, then that means a bone in the body may have fractured. There are 4 types of fractures. An oblique fracture is a hairline fracture. A comminuted fracture breaks into pieces. Spiral fracture goes up and twists around. And lastly, a compound fracture, which happens when the bone separates out of the skin. A subluxation is otherwise known as a dislocation, or when the bone moves around or pops out of the socket. On the other hand, the muscle system fails, then your body will fail. The heart and lungs are both made of muscle, so they wouldn't work. Also, the brain would quickly lose oxygen and the body would collapse.
A dislocation occurs when the entire ball is out of the socket in a ball and socket joint. A shoulder dislocation happens when the clavicle separates. It normally will occur during a fall. A dislocated shoulder can cause extreme pain, and it is very hard to move your arm. There may also be swelling and bruising in the shoulder. The other injury that occurred is a tear in the labrum. The labrum is cartilage that forms a cup for the end of the arm bone to move within. Also, it circles the shallow shoulder socket to make it deeper. When the cartilage rips, there is a tear in the labrum. The player suffered from a Bankart tear in the labrum, which occurs when a shoulder dislocates.
A tear in the labrum will normally require surgery, which will then lead to physical therapy to regain strength and movement in the shoulder. The first exercise will help to regain the strength to pull things and move the arm inward. The elbow stays locked to the hip, which uses more of the shoulder to do the work. The next exercise helps in moving the shoulder back outward. Again, the elbow stays locked and the arm works the band outward. In the third exercise, you hold the band with both arms and try to keep the elbows tight to the body. By pulling on the band outward like opening a book, the shoulder is regaining its strength and movement near the clavicle and labrum. For a final exercise, grab a baseball and put it on the wall above your head and rotate your hand on the ball clockwise, counterclockwise, and then up and down for about a minute each.
After you have finished physical therapy, it is important to keep your shoulders strong so that the injury does not reoccur. The first shoulder workout is the seated dumbbell shoulder press. It is important that you bring the dumbbells down to the shoulder and straight over your head. The next exercise are lateral raises. Take dumbbells of weight that you can handle. Raise your arms upward, making sure not to bend your elbows. This exercise requires the deltoids to do a lot of the work. Another exercise is the T dumbbell flies, which help build muscle in the rotator cuff and shoulder blades. It is important to keep your shoulder blades tight and locked when doing this exercise. The next exercise is the Bradford press that uses a barbell. Simply press the bar over your head to your back, and then press it back over your head to the front. This exercise is a good exercise to finish your workout because it is good for repetition and you will feel the burn. The final exercise is a cable exercise where you cross the cables to the opposite hand making an X. Hold them right at the top of your head and pull down and outward till your arms extend. These exercises will help you gain a lot of muscle in your shoulders and will help you to regain your strength and stay clear of injuries.